Um, if you haven't already muted yourself, if you could go ahead and do that, that would be greatly appreciated. So thank you everybody for joining us tonight to our first ever PD Active event focused on advocacy. My name is Monique Buffler. You may recognize me. I am on the events committee with Todd. I also joined the board of directors of PD Active last year. And when joining the board, I was really interested in bringing my passion for advocacy work to the cause of Parkinson's. And when HR 85 was introduced in the House last summer, fellow board member Suzanne Calpestri and I decided the time was ripe to join forces with the PD Active community to advocate for this monumental piece of legislation. So our goal for this event is to empower you with some knowledge and some simple ways to have your voices heard. And we are hoping for a big turnout this week from our PD Active community. It will indeed send a strong signal to our legislators that we, the East Bay Parkinson's community, is concerned and ready to take action. So a quick word about the agenda. After the presentation by our guest speaker, we will open up for Q&A. Please go ahead and post your questions into the chat box or raise your hand and we will call on you. After the Q&A, we'll spend some time helping people write some letters, and we are willing to go a little bit past 6:30 if needed to do that. We will be recording this session, so please let us know if you have any concerns about that. And as always, it will be posted on our events page after the event. So now I'd like to introduce two PD Active members who will be moderating the discussion, Nancy Husari and Brooke Deputy. Nancy and Brooke are both experienced public policy advocates. In 2018 and 2019, Nancy and Brooke both went to Washington, D.C. to do advocacy training with Michael J. Fox organization. And there they learned all about meeting with their representatives and letter writing and making compelling arguments to the legislators.
That has been great.
So we're very fortunate to have such a wealth of knowledge and experiences with us today. With that, I will turn it over to Nancy, who will introduce our speaker. If you could please mute yourselves. If you're not talking, that would be great. Thank you so much. Nancy.
Hi. Oh, hi. I'm Nancy Husari, and Brooke Deputy and I have been inspired by the energy of the Michael J. Fox public policy forums, both in DC and in their online forums since the pandemic. Michael J. Fox Forum's advocacy work has been easy to plug into because of the clearly formulated asks for PD funding, research, and legislation that we PD advocates can bring to our legislators every year. This year's ask, support for the National Plan to End Parkinson's Act, is much more ambitious, comprehensive, and far-reaching than the asks of previous years, and that's why it's so important to get involved. We'd like to thank Nora Eigenbrodt, Public Policy Officer with Michael J. Fox Foundation, for sharing her knowledge about the bill with us this evening. So welcome, Nora.
Thank you so much, Nancy, and thank you to everyone who helped organize this and to you all for being here as well. We're really excited to see the kind of grassroots energy around this bill, and I am hoping to include all of you in that as well if you're interested. So I will go ahead and share my screen now. Just have a few slides here. Wonderful. So presentation today. Like was mentioned before, please feel free to put your questions in the chat box. Would love to have this be a conversation, answer anything that I don't cover. I'm also very available via email if something comes up tomorrow, next week. We really want to be here for our advocates who are volunteering their time to really help us push this legislation forward, because we are very excited about it as well. So yeah, so just to kick it off, also, I'll just introduce myself a little bit as well. like Nancy mentioned, I'm a public policy officer with the Michael J. Fox Foundation. About 75% of my work focuses with engaging our grassroots advocates like yourselves. So I work a lot, I've worked directly with Nancy before. We've done a Hill meeting or two, which has been wonderful, but just helping people empower themselves in the Parkinson's community to speak directly to their legislators about what matters to them. But another big part of that is just making sure we're in touch with the community so we can hear firsthand, oh, this is what we should be focusing on. These are the real issues, et cetera. So we always want to have an open door, make sure that we are kind of plugged in to what's really important that we can then take with you to the Hill. So the other 25% of my work is in the policy space, but specific to long-term care, caregiving, et cetera. So if anyone ever wants to talk to me about those specific issues, I'm always here too. So I wanted to, before we get into the main event, which is the National Plan to End Parkinson's Act, I wanted to just give a little overview of the sort of things that we on the Michael J. Fox Foundation policy team really look at when it comes to Parkinson's policy priorities. So this is maybe helpful for you if you want to stay plugged in with us, if you want to advocate with us on future issues, if you have specific areas that you're most interested in. These are just sort of some of the things that we've been looking at recently. So for example, as you may are probably aware, the Inflation Reduction Act just passed. There were some really great things in there in terms of what we look at for access to care. So that's a big part of our portfolio. It's making sure that people can access the healthcare that they need. So really we saw a pretty great expansion of access to care under Medicare Part D in that bill, annual out-of-pocket cap of $2,000 on prescription drugs, not reimbursed, and then the ability to spread payments over a year. Those aren't immediate impacts, and we know that long-term things, they can be a little frustrating or disappointing, but we were grateful to see that happen, and we did push for that as well. Another thing we look at a lot is research freedom. So making sure that the Michael J. Fox Foundation is primarily an organization that funds research into finding a cure to Parkinson's disease. That's why Michael J. Fox created it. That's what we're primarily here to do. We also want to ensure that on the federal level into things like access to care and different treatments that might help people in the community. So we pushed pretty hard for the Medical Marijuana and Cannabidial Research Expansion Act. The House passed it. The Senate is expected to pass it. Essentially what that does is just remove some barriers to research into medical marijuana that might hold promise for folks with Parkinson's. We've done surveys as an organization. We've seen that this seems to be helping people in the community. So we're kind of focusing our efforts there as well. And then finally, on our state side, we've been expanding our state policy team. So I have to plug them. They've been looking at establishing state Parkinson's disease registries that really help kind of coalesce information about PD in certain states that's really important for researchers and the research they do. So our team managed to help get state legislators in West Virginia, South Carolina, and Maryland passed this year, which is exciting, but none of that could have happened without very plugged in advocates on the ground who are really in touch with their state legislatures and really helped us push those through. So that's another avenue that we always look for folks to help out in is if you're really plugged in, you have a connection to a state legislator, we're always looking for help there. So those are just kind of some things that fall into these buckets that we really look at. One of those buckets being obviously research funding, making sure that we have the Fox Foundation is currently, I believe, the biggest nonprofit funder of Parkinson's research. And we're getting close to passing the federal funding level for Parkinson's research, but that's not what we want. We want both of those numbers to keep going up. So federal research, access to care, and then also looking into environmental triggers for Parkinson's as well. My colleague is working on policy in that area, whether that be pesticides, things in the veteran space. So, burn pits, jet fuel, et cetera. So that's a little overview of what we do. But now I'll turn to the reason we're here today and what we would really love to have your help on. And that is the National Plan to End Parkinson's Act. So You may be familiar with this already. You may be very tuned into the news, but I'll just give an overview, kind of dig a little deeper into what is this bill, what would it do, why are we pushing for it, et cetera. So this bill is really exciting because there's really nothing else like it in the Parkinson's space. It's actually very difficult to get disease-specific legislation introduced on the Hill, which is something I didn't know before I started here. It's because a lot of members will just really want to take on broad legislation or things that impact as many people as possible. But we knew, talking to the community, that we need something that drills in very specifically for Parkinson's. So essentially, this bill is modeled after a similar piece of legislation that you may also be familiar with. It passed about 10 years ago, and that's the National Plan to End Alzheimer's Act. So that is a piece of legislation that was really, truly pushed forward and pushed onto the main stage on the Hill by grassroots advocates, by people with the disease, caregivers, researchers, et cetera, making their voices heard and pushing it through. Since that act was passed, we've seen a huge increase in the number of federal research dollars that are going towards Alzheimer's disease. It's been a pretty immediate kind of impact that we've seen is, okay, this is a big issue, it's on the table for members of Congress, and they're going to act on it. So we're really hoping to rally support for Parkinson, for finding a cure for Parkinson's, and also for providing for and addressing the needs of people in the PD community with this bill. So first ever legislation, big deal, but what will it do? So if passed, this bill will, for the first time, essentially unite the federal government and private enterprise in a mission to prevent and cure Parkinson's. So what does that mean, unite the federal government and private enterprise? So there are a lot of different individual federal agencies that deal with Parkinson's or address it in some way. So an example of this, for instance, is the EPA. We are currently, with Earth Justice, suing the EPA for reintroducing and legalizing a pesticide known as paraquat, which you may be familiar with, which has direct ties to people who are exposed to paraquat, perhaps developing Parkinson's disease later in life. So EPA touches on things that directly relate to PD. The VA, the Department of Veterans Affairs, has specific programs for vets with PD to give them specialized healthcare that they need. So a lot of different federal agencies who are kind of dealing with Parkinson's in some way, but not talking to each other. Not having kind of big plans or ideas about how to address this disease and how to meet the needs of the community as well. Additionally, they need to hear directly from, not just industry, but also big organizations that are connected to the community, members of people with PD, caregivers, et cetera. So the advisory council will basically kind of coalesce a group that will be tasked with creating a plan to address the big issues that we have on the table with Parkinson's disease. So finding a cure, putting research into finding a cure, directing money that way, access to care issues, et cetera. It'll be tasked with that. Those are the kind of general questions that they're seeking to answer or find a solution to. Once we pass this bill, then we start the next stage of advocacy, which is the appropriations part. So this bill passes. In some ways, it's a nice, it makes it easier to ask your member if they're particularly fiscally conservative. There's no money attached, but there will be because we need to direct those funds to the advisory council and to the plan that is created and execute that. And that is essentially what happened with the Alzheimer's Act as well. So we're really excited because we've seen a lot of support. We've gotten really good feedback from the Hill so far. Just so many members who will just come out and say, oh yeah, my dad had Parkinson's, or, oh, my brother-in-law has Parkinson's, or, all these connections that we're making that show that this is really close to home for folks on the Hill. But we also need that sort of grassroots energy to show that it's important to their constituents as well. So a little overview of where we are at in the legislative lawmaking process here. Some of you may be aware, if you're subscribed to our emails, last week on September 14th, we got the Senate version of this bill introduced, which is great to see. So in July, I believe we had the House version introduced. We are excited because these are both bipartisan introductions. So on the House side, that was Congressman Bilirakis of Florida and Congressman Tonko of New York introduced it together. And then the Senate introduction was Senator Shelley Moore Capito of West Virginia and Senator Chris Murphy of Connecticut. So also a bipartisan introduction. That's really great to see because in this political climate, as you can imagine, we need things that have the backing of both parties if we want to see them pushed through and ultimately get to a vote. And so far as well, part of what we'll be asking your help in is asking your specific members of Congress to co-sponsor this bill, which essentially means putting their weight behind it. It's an indication that they'll vote for it, but it's also putting it more on the main stage. A bill that has a lot of co-sponsors, that's getting attention, that's maybe getting scheduled in for a vote, things like that. It's all really important. And so far, when we look at, we have about 24, I believe, co-sponsors on the House bill. It's been pretty well divided between both parties, which is really what we like to see. And so that's a great sign too. So September 14th was Senate introduction. We now have both bills, which are essentially identical. September 22nd, so that is this Thursday, is the day of action. So I'll be getting into that a little bit later, just so we know why are we doing this? What are we looking for from advocates as well? But if we fast forward a little bit, we see September 30th as the end of the fiscal year. October, we have election recess, so we'll all be voting. And then November 8th, election day there. And then wrapping up towards the end of the year in December, we have what's called a lame duck session. Many of you may be familiar with this. It's essentially just the name given to the end of a legislative term when there has been an election. So you have some members who are kind of on their way out the door, whether they've retired or whether they've been replaced or voted out. And sometimes you have, interestingly, a bit more wiggle room there. You can have a little bit more political capital, so you can push things through that might otherwise have gotten stuck. So when we look at our kind of strategy here for what we're trying to get done, we're really trying to push this through by the end of the year because we know that time matters. That's what we've heard loud and clear from everyone is we need this done yesterday. So that's why we're really trying to coalesce this energy through the end of this year. If for some reason we are not able to pass these bills, nothing is ever guaranteed in Congress, unfortunately. There's a lot of deadlock, etc. We will reintroduce them next year and then just keep pushing forward on these. So that's kind of the general plan and what you can expect moving forward. So I just wanted to touch on ways to become an advocate in general, and then kind of drill into what we're asking and how we've tried to make it as easy as possible for folks to participate in. So when we talk about ways to become an advocate, calling your representative is still a tried and true method. We don't really mail letters much anymore, but calling is expected and calling is necessary. We are trying to really focus on calls for the National Day of Action, just because I think calls are most effective when, I'm saying this as a former congressional intern myself, when I got 10, 15 phone calls about the same exact issue, but from different people who had different perspectives all in one day, I'd say, okay, something's going on. We're having people who are really coalescing about this. This is something that I have to flag for the rest of the staff. So generally calling is great. I will link to, when I talk about the Day of Action, a specific website that we have that covers a lot of things national plan related, but also has a call script. It's very cool. I wasn't familiar with this technology, but essentially you put in your address, it will give you a script, and then you can actually call straight from your computer. So you just click the button and it'll call for you. It also gives you the phone number if you prefer to call via landline, cell phone, etc. All good. You might get a voicemail and then you just leave a voicemail. You might get a person, and you can just use the script. I'm sure many people are familiar with this, but that's really what we're pushing for Day of Action. We're also really pushing requesting meetings with your legislators. This is something you can do as a group. If PD Active was interested in setting up a meeting with their legislator, district offices are actually really looking for, they want to maximize their time with constituents. So if you're one person going to represent an issue, that's great. But if you say, oh, I'm part of this whole organization and we represent this many people and 5 of us are coming into the office, they're going to say, that's great. We would love to hear from you, because they really just want to get a handle on what their voters are saying and what they're interested in. Talk about national plan in your support group, in your community at large, family and friends. I think National Day of Action is a great thing to sort of coalesce around. So if you are interested in sharing this with your community, you can say, I would love for you to make a phone call this Thursday. That's the ask. I'm doing this, my friends are doing this. We're trying to get everyone to really take action on this specific day, just so that we can have that big push in one day. And then attend a town hall or community meeting. Some of you may have done this already. It's a great opportunity. They're looking specifically to hear from constituents about the issues that matter to them. Generally, I think, having those in-person contacts, if possible, or virtual is great too, with the district office of your legislator. It can really, we've seen advocates who have essentially become a legislator's go-to person on Parkinson'S. So they'll say, oh, this came up, I'm going to reach out to you because you are always in my office talking to me about PD. You probably have thoughts on this. And that's, sort of the ideal situation is you can kind of become that voice if that's what you want to do. But really any of these steps is great for making your voice heard as well. So National Day of Action is this Thursday, September 22nd. Like I said, we're really just trying to gather a huge group of voices, take those to the Hill, and just make sure that this is on legislators' radars. Then we'll conduct follow-up. We'll say, oh, you heard from so many constituents about this. How about co-sponsoring? How about putting your support behind this bill? How about connecting with us further on these issues? That's really what we're trying to do with this sort of groundswell. So we have a specific website that is for the national plan. I'll also share this in the chat box just so it's easier to click on. But essentially it will cover, we have a frequently asked questions about the bill. We have our link to calling your legislator. We have our link to writing a letter, essentially an email to your member. We have a lot of different opportunities and, just choosing what you want. We even have, if you want to take it a couple steps further, we have information on how to reach out to local media. So if you're really energized by this, you want to write a letter to the editor for your local newspaper, that's great. Definitely let us know. If you need any help, again, facilitating this, we are on hand. We have this policy@michaeljfox.org email box, and we will be sure to kind of connect with you if you have any questions about taking steps involved with national plan advocacy. We also have reach out to members, look for events. But really what I would say we're pushing for National Day of Action is phone calls. And it's also sharing. So just sharing with your community, trying to widen your outreach. So we have some sample social media messages if you are a Facebook or Instagram or Twitter person. Otherwise, just word of mouth, however that works best for you is great. So that's really what we are trying to do for this day of action. Of course, you know, the fight doesn't stop there. We just get up the next day and at the Fox team and keep doing it. But I think this is a really great opportunity to kind of get people involved, especially people in your community. So just general tips for speaking to elected officials. Some of you may be seasoned advocates already. Other of you, it might be your first time. All of that is totally fine. We do have an advocacy toolkit if you want to really get deep in on best practices, but overall, it's really just a pretty normal conversation. So if you're like me and you like to plan ahead, that's great. We have scripts available so that you can just kind of follow those. Generally, any conversation, whether it's a phone call, a meeting, even an email, you're just going to introduce yourself. They really care about where you live to make sure that you're a constituent. That's a big one. But then, of course, what's really important is your connection to Parkinson's. Whether you're a person with Parkinson's, you have a loved one with Parkinson's, you're a caregiver, we work with researchers, you're a researcher, etc. They want to understand why the legislation is important to you specifically, and why it's important. So I think that's what we'll be doing maybe later in this call, just, you know, practicing writing down our stories or making sure that we have them ready to go is always great to see. Stay on topic. I think that's generally helpful. Your elected officials deserve to know everything on your mind about any policy. You can absolutely call them back, keep them updated on how you feel about certain bills. They're there for that. But generally, we think it's most effective to just stay to the specific legislation for the specific call that you're doing. Ask for a written response. This is something that they're very used to giving, and it's kind of nice from an accountability perspective. So, you know, if you ask, oh, could you actually give me a response? You know, because a lot of times they'll say, okay, thank you for your message. I'll pass it on to the congressman. You say, okay, but can you follow up with me with a written response from him? That is a perfectly acceptable thing to do. Sometimes it kind of just makes it register for them more when they're writing that response. So recommend that. Follow up if needed. I think sometimes when I first started doing this, what made me nervous was occasionally you'll get a staffer of a legislative office who will just really want to dig deep into the bill. So they might say, oh, is this legislation, is it connected in some way to this such and such bill that passed 14 years ago? And in my head, I think, I've never heard of that bill. I'm not sure. That's totally fine. If you do get some specific question or you're engaging in conversation, 100% fine to just say, great question. Let me circle back with you on that. Let me get back to you on that. You can go ahead and email us, the policy inbox, you know, whatever avenue you want. We're here to help with those sorts of questions. And then that just gives you actually a reason to follow up with them and to keep that conversation going. So I'd say it can be a bit intimidating, but generally they do this all day and, you know, they're very used to that sort of conversation. And then finally, be courteous. That is a pretty basic one. You know, as someone who was on the other side of these calls, they can get 100 a day. So it goes a long way to just acknowledge that. And, you know, the work that they do as well is always great. So yeah, like I said, we have a toolkit as well. But generally, I think with the scripts that we have on our website, we've tried to make it as easy as possible for folks to engage at whatever level they would like to. And I think that's all I had. Yeah, but thank you so much again for having me. Oh, I forgot to mention, yeah, I'm from California originally. My mom grew up in Piedmont, so the Bay Area is very close to home for me. And yeah, I really look forward to, you know, answering any questions, and also thank you in advance for your advocacy and for helping us make this happen.
Great. Thank you so much. That was wonderful. Go ahead and put some questions in the chat if you have any, please. I did put a couple links in the chat, one to the toolkit that Nora mentioned, and also one to the Michael J. Fox National Plan website. And I just clicked on it incidentally, where it says call your representative. And it does take you to a page with the script and the phone number and everything. So I can attest that they have it set up nice and easy for us. So thanks, Nora.
Also, I wanted to say, if you're more comfortable raising your hand, there's a reaction button down at the bottom of your screen, and it says raise your hand, and we'll call on you, and you can verbally ask a question. I think there's one question here. Should we start with, are there any early hints as to what the plan will consist of?
That's a great question. Not that I'm aware of. I think a lot of the time, the big thing is putting more money into research. It's putting more federal dollars into research to try to accelerate a cure and to accelerate treatments, et cetera. I think that's what we saw come out of the Alzheimer's plan. And that's also something that we've identified. We were doing some research. I'll have to find the actual numbers because it's a good talking point. But we compared federal research dollars or money in general spent on cancer by the federal government and money spent on Parkinson's by the federal government. And how the numbers worked out is that the percentage that goes to, so the bulk of it is Medicare, it's specifically care access versus research. But the percentage that was spent on research for cancer was much bigger than for Parkinson's. So we really want to address that because we know that, putting that money, putting that pressure on research is what's really going to help accelerate those timelines. So that's my initial guess if I had one based on kind of the previous plan and what we're going for, but it will certainly be a lot more than that too.
Okay, Suzanne asked, how can I track this legislation?
It's a great question. So I would say if you are signed up for our emails, I just sent out an email about the Senate introduction to make sure everyone was up to date on that. If you use any of our forms, you can opt into our emails there, but I can also send the sign up one. Additionally, I can drop the link for the congress.gov link to the legislation. So that will update, it'll give you information on, oh, there was a hearing scheduled about this, or, it was taken to the floor, the more granular details. So I can drop those links in too.
Okay, I have another one on chat, and then I see somebody raise their hand. I got an email back from my representative after I sent the MJ Fox email to them, but the response didn't say anything about the Parkinson's bill. Should I request a more specific response to make sure they know what I want them to support?
Yeah, I think that is definitely worth a shot. I think sometimes it depends on offices. So some offices have different standards for, we're going to send you a very specific response about this for everyone. Some offices just tend to get way more influx of messages than others, depending on a few different factors. So they might not have the staff capacity to send that specific response. But I do think it's worth a try to kind of follow up with them and say, can you give me a more tailored or specific response to my request? So.
Okay. Patrice, you like to unmute yourself there? Yeah.
So is cancer more prevalent than Parkinson's? Has anybody done a comparison there? Because I mean, if they spent more on cancer, but more people get cancer, or is it the reverse?
Yeah, so it's, I don't know about the specific prevalence, but the figures we were looking at weren't necessarily about, the total amount of dollars spent, but just the percentage. So if you look at the whole bucket that is spending by the federal government on cancer versus spending by the federal government on Parkinson's, they might be different sizes, but how you break that down, if the spending is on, Medicare or Medicaid services versus on federal research investment. That's kind of more what we were looking at.
Okay, thank you.
Sure.
Okay, another question, my congressman is already co-sponsored. What else can I do to support the bill?
Great. That's wonderful to see. So now we look at senators is really the next big step. So I don't believe either of California's senators are co-sponsored yet because it's so recent. We have only, I think, 3 or 4 co-sponsors right now, maybe 2 or 3. So I would focus your efforts on the senators, and if our website is working properly, it should let you know that. So you're not, wasting your time sending a message to someone who's already on board. So yeah, I would look at senators. I would also look at reaching out to friends and family as well. Generally, if someone has co-sponsored already, you can send them a thank you message. That sometimes goes a long way, but better to kind of focus your efforts elsewhere as well.
A follow-up question to that would be, is it strategic to find which states don't have a co-sponsor and then reach out to people that you might know in those particular states? And if so, how do we find out who those people are?
Yeah, absolutely. That's a good question. I think that does make a lot of sense. And especially as kind of a next step strategy, if you want to scale up your advocacy, I would refer to, I'll drop them, the congress.gov bill tracking. So yeah, not only will that tell you exactly where it is in the legislative process, but it will also show a list of co-sponsors too. So if you see someone on there, you say, okay, we don't have to hit them. Can reach out to my other friend from Arkansas and make sure they're on the page as well. So yeah, I would recommend that. Sometimes it's a little slow to update. That's a pretty granular heads up, but it might be slightly behind, but it's generally accurate.
Jen, you have a question?
Yeah, I had a sort of follow-up question from what Monique asked. Are there states that Michael J. Fox is particularly focused on trying to get people in that we should know to reach out to our family and friends there?
Yeah, that's a great question. I think that we're looking at longer term strategy. I bring this up because I suspect that a good amount of you may be represented by Congresswoman Barbara Lee, if I'm not mistaken. So she's an appropriator. She's going to be really pivotal for the second stage of this bill, the appropriations, like the money stage. So I think generally we look at appropriators. There may be sort of committee specific. I'm trying to think. Yeah, I think generally we're just, especially when it comes to co-sponsoring, we're looking for everyone, just as much support as possible. But if they are on the appropriations committee, that's great to see. I believe E&C committee as well. I'll look this up after and let you know. But yeah, I would say if you wanted to go down to the committee level, that's helpful. But otherwise, everyone is good.
I want to say that last night I sent some of the information to 5 different people and asked them to just push the button and write their letter and say something about Parkinson's, how it affects them. And 4 of them wrote me back today and said, done. So it was very easy. It took 10 minutes of my time, if that. And Michael J. Fox has made it very simple. It's very easy to do. And as I understood it, if their congressperson had already signed on to the bill, the letter would not go to them the way your system's set up. So you don't have to figure that out in getting people to co-sign the bill, co-sponsor it. And then we have a question about how about letters to the editor?
Yeah, absolutely. And thank you so much for sending that. That's wonderful to hear that they also had a good experience. Yeah, I would say you don't have to worry about, doing research to see if their senator or representative has already signed on, because in our system, it shouldn't forbid you from filling out a letter. It'll just change the letter into a thank you letter. So rather than saying, the pre-populated letter, oh, please co-sponsor this. It'll say, thank you so much for co-sponsoring this. This means so much to us as the community. So
Okay.
that should be all covered. Yeah. And yeah, it's as easy as just immediately sending, or, we do encourage you to personalize that letter as well with your own personal story. That's always helpful too. So yeah. And then yes, letters to the editor. So on that National Plan Action Center, we do have, I believe, a tab for letters to the editor. It's generally just a really brief sort of draft, so pre-populated again. That one we don't have a tool where you can just send it to your newspaper, but you can take that, you can copy paste it, edit it, add your own story, and then reach out to your local newspaper as well. And again, we're on hand if you need help, sort of locating contacts or whatever it may be. That is great though, because also speaking as a former congressional intern, one of my jobs was to look at every local newspaper in the senator's, or in my region of the senator at the time's district, or state rather, find any instance where his name popped up, and then create a clipping of that, create a clipping of everything, and then he would read that with his morning coffee. So if you think it doesn't go directly to them, it does. So recommend not just writing a letter to the editor, but also naming your representative, your senators, etc., just to make sure that that's really getting on their radar.
Any other questions? Or comments?
Nora, I have a question. Pardon my naivete. I'm not super good at navigating all these, how these bills go through Congress, but can you tell us one more time sort of exactly what has to happen for this bill to get passed? Like what is the next sort of things that need to happen?
Yeah, absolutely. So generally there is the House bill and the Senate bill right now. We're at the stage where they've just been introduced. So they're collecting co-sponsors, but they're kind of sitting there waiting the next step. After that, they'll be referred to the committees of jurisdiction. So any committees that are specifically related to this bill, the committees will do a kind of review process, and they'll vote on it. So if it gets a positive vote, it gets voted out, and then it gets ready for a general vote. So that vote then has to be scheduled by the House or by the Senate. If it gets voted through, we make sure that those bills look the same. Sometimes you see something where there are amendments added on, things that make them different, that has to be reconciled. Sometimes that can send it back in the process. But then generally, if they're both voted through and they're reconciled, then it goes to the president's desk to be signed. So a few steps in there in the beginning. We are actually looking at the potential to perhaps add this legislation as an amendment, maybe to a package deal, something like that. There is a chance that it could go that way, especially during the lame duck session. But that is something that my colleagues are working on, and I'm still, they're figuring out essentially the best legislative strategy for it. So no one path. We're looking at a couple of different paths, but that is generally what to expect.
So are there a certain number of co-sponsors that it needs in order to go to the committees?
So the co-sponsors, there's no number that will kind of push it. The co-sponsors are generally just about crowdsourcing support on the Hill for a bill. So, generally you see legislation that has a lot of co-sponsors move forward at a faster rate, but there's no specific number that we're looking at.
It looks like Ginger has a question.
I'm from Minnesota. I got an answer from Amy Klobuchar already, similar to the one that was mentioned. Is she a sponsor by any chance?
Amy Klobuchar, Senator Klobuchar is not a sponsor, but Tina Smith is one of our original, or not original.
So good.
Yes, yeah, she was an early supporter for us.
Okay,
which is-
that's good to know.
Mhm.
Nora, one of the things that I found interesting that I didn't quite understand before, I think, is that if the bill doesn't pass in the lame duck session, and then you have a whole new group of people coming in, you have to start all over. Is that true? Yeah, with sponsors, and I mean, it's basically that's how it works.
Yeah, it's start all over, but it's not from scratch. So generally we can call on, assuming they're reelected, if they're up for reelection, we can call on our original leads for both bills to reintroduce. That's pretty typical process. So we won't have to we did a lot of groundwork from the beginning of this year to July to build up support and to find those leads and to have them introduce it and to go through the process of what does this bill text look like? How can we make sure that it's checked for everything? How can we make sure it goes through these processes, et cetera? So we'll be going into it, if we have to do it next year, with leads already theoretically, who we can count on to introduce it pretty quickly. And then also support that we can, if we had existing co-sponsors last time, those are easy asks for us to kind of just go back to them quickly and say, hey, can you re-sign on to this? So it is starting over, but it's also building on what we had before.
Great, good. And Judith.
Yes, are there bill numbers we should be referring to, or just the title?
The bill number is great to refer to, just because that's something where they'll take that down and they can easily search it up. So it is HR 8585, and then this one we just got. So if anyone knows it in the chat, I can put it. I believe it's S2581 or 2851. Why is mixing numbers in my head? I'll throw them in the chat though, just so we have them.
Okay, that would be helpful. Thank you.
No problem.
Is there anyone else that wants to ask Nora a question? Not,
Are there other diseases that are receiving the same kind of advocacy at the moment that we'd be sort of competing against?
Yeah, this is a great question. So part of the pitch we're making for this bill is that we have the Alzheimer's equivalent. Alzheimer's is the #1 most common neurodegenerative disease in the US, and Parkinson's is #2. But Parkinson's is also, the fastest growing. So we are seeing those numbers increase at a more rapid rate than Alzheimer's. So there's really, at least in the neurodegenerative disease field, there isn't a sort of equivalent legislation out there right now. There is some legislation that touches on neurological diseases more broadly. Specific federal agencies that deal with them, appropriations for that. I think someone put in an NCSS in the chat, actually. Yeah, the National Neurological Condition Surveillance System. So we see more like that, but there isn't really a direct equivalent here, at least in this field.
So Nora, if I've sent the letter already, is it okay still to call on Thursday, or do they keep tabs of you and like ding you if you're like, bombing them, calling in twice?
Yeah, good question. We definitely recommend you still call. I think, if you were calling nonstop for, 5 or 6 times in a row, that might, raise some flags, but generally they expect constituents who are passionate about it to reach out in a variety of ways.
and remember that neither of our senators has supported it. So there's 2 senators we can contact.
And it doesn't look like Barbara Lee has co-sponsored
hasn't.
yet either. Is that right?
That's correct.
Okay.
Yeah.
So just to,
Go ahead.
I was just going to say, so there is a handy link that I'll drop in the chat too, which tells you who your actual representatives and senators are. You can put in your address and it can bring them up for you. But also know that the links that we for the Michael J. Fox when you go to draft your letter, you can put in your address there and it'll bring them up automatically for you. Isn't that right, Nora?
Yeah, that's correct.
Yeah. I'll put that link in there as well, but there's also, if you want to know who they are, you can just enter your zip code in and it'll find them.
Okay, Kathy, you have a question?
Yeah, when you sent that automatic email, does it go to all the different representatives or just one person? I didn't really see who it specifically went to.
Yeah, so we have a, I think the one on the website now should be our combined, it's called campaign. So if it gives you just one, it'll usually tell you, it'll say in the kind of like who the representative is or who the senator is. But for our combined campaign, it should give you messages for both your senators and your representative that you can kind of scroll through and edit if you'd like. So should go directly to them.
Thanks.
And one little trick that some people don't know, but there's 3 little dots on your chat next to some of the chats. And if you click on the 3 dots, you can save your chat. So you don't have to be worried about getting all this information right this second. It will actually save when you get off the call.
And we can also send a follow-up. I think we're going to try to send a follow-up
Right.
Wednesday so that you guys have all that you need on the day of action if you haven't already done it. So we'll kind of provide an outline of what you can do on the day of action and some of the links.
There aren't any 3 dots.
Down on the far right where you can send a chat.
Oh, I see.
Or it says to everyone or to yeah.
Okay, and where does it save?
It says to everyone, and then there's a little happy face and a little square, and there's 3 dots.
I found the 3 dots now.
And then it says save chat. You can
Yeah.
save chat. You just click on save chat.
But where does that save to? I mean, how do
Oh,
you?
when you go off, there'll be a little message on your on a Mac anyway that has a link, and I just click on the link, and then the chat
Oh.
comes up.
Okay,
I
thank
think
you.
it goes to the documents folder. I'm not sure, but someplace
Oh.
that.
Yeah, I'm only a Mac person, so I can't tell you about the others.
Okay.
Now, I know we talked about saving some
Yep.
time for people to actually work on it while we're still here meeting. I think if we don't have any more questions, that we could go ahead and you can try clicking on some of this and seeing if what comes up for you. And then if you have questions, of course, Nora's here to respond.
Yeah, absolutely. And if you want to keep it simple and just, it's as easy as putting in your information and clicking send, that's great. But we also do encourage you to write a little bit about, whether it's your personal connection or why you care about this legislation as well is always great to see. So.
I'll be curious how many letters we can generate just from this meeting.
Yeah, me too.
So if you're going to go ahead and do it, if you haven't yet, click, the link is in the chat now, and send your letter and tell us, and we'll keep count.
Yeah, letter today, call on Thursday. It's it's perfect. We love to see it.
And I wanted to say I got an instant notification back from Alex Padilla saying, thanks for the letter, and we'll look into this and get back to you. So I thought that was pretty good because Diane Feinstein usually takes about 3 months to get back. So, yeah.
It is interesting. Like every office is so different. Yeah.
Yeah. Right. Yeah.
Yeah, I think these are all, California senators are great targets. I know I believe I've had meetings with them before, and they've been very, tuned in and interested to hear more about Parkinson's policy priorities. So yeah. I'm hopeful we can, these are achievable targets for us.
So is it reasonable to expect that this could all go through this Congress, that we could get the legislation through the House and the Senate and onto the president's desk by the end of the year?
It's definitely possible. It's hard to say for sure of anything in Congress and in kind of the political climate we're in, but that is our aim. So we believe that it is, it's feasible.
Okay.
I was going to suggest if you have already sent your letter, you might think of, Brooke was really inspiring that she sent it to 5 people and they all did it. So whether it's your children or your neighbors, or, if you can pull up a few people and forward it, that link on to them, that'd be great.
And if you have social media, you could post it to your social media account.
Yeah, absolutely.
Twitter, Instagram.
Facebook. It makes it very easy. The links are right there. After you write the letter. Or
Yeah.
send the letter.
And I know on the day of action as well, our social media team at the Fox Foundation is going to be, just making sure to catch every advocate who's posting about it and engaging with it too. So should be some good content.
Anybody sent a letter?
Yeah, comment in the chat.
I'm emailing my family all across the country right now, asking them to do it.
That's wonderful. Thank
Great.
you. And we've tried to make it as easy as possible to not take up too much of people's time, but also to provide opportunities for folks who do want to get involved on an even deeper level to do that too. So choose your own adventure.
And is that similar then for, like, if I send it to my dad who's in New Mexico, he'll click on the link and it'll pull up his people?
Exactly. Yeah. Once he puts his address in, we'll just
Okay.
grab the legislators.
And I think, as Brooke said earlier, that if for some reason they have already signed on, it won't send them a letter, it'll send them a thank you letter. Is that what you said?
Yep. Yeah. So we keep that updated on our back end based on sometimes we're quicker even than the congress.gov listings on making sure we have the most up-to-date sponsors. Still great to send them a letter, but it becomes a thank you.
So what did you guys say about Barbara Lee? Is she co-signing or sponsoring or not yet?
We don't
Not
have her
yet.
on board yet.
Okay.
But she will be kind of key. She's on the specific appropriations committee, I believe,
Okay.
that this bill would be in. So.
Okay, because she emailed me back saying thank you for your email and I will support my constituents, something like that. But it's very vague and it doesn't say anything about the bill. So you do think I should write her back and say something about the Parkinson's bill specifically, just so she knows that's on my mind?
Was this like an automatic email that came through once you sent it, or was this something that
think
came
so.
in? Okay. Because sometimes if you read the email, they'll say, we'll get back to you with an actual response in time. So if it does say that, you can wait on that. Otherwise, if they only send the auto email, they might not be, contacting constituents who reach out via email on that deep of a level, but it's worth a try if you do want to respond. I guess I would say with that sort of thing, like before, I wouldn't expect necessarily a more in-depth response, but it is worth a shot in case it does put it on kind of a higher level of their they're looking at.
Yeah, it does. It kind of reads like an auto response. That's what it seems like. And I just want to make sure that my, my email was read and seen,
Right.
I have a question.
Okay, thanks.
I was filling out the form. They didn't like my email. I want a Firefox relay. Why is that?
Oh, okay. It didn't like your email address.
My email was fine. I wanted to go to Firefox relay.
I went to Firefox Relay. I don't
want to do that. But it's perfect. I don't understand why I didn't like it. So I can't preview it.
Sometimes there's a might be a typo. That'd be one thing to check.
Yeah, we've had a couple instances with the address form, which is why we recommend people use, there'll be kind of powered by Google pop-up address. And that's how the system works best, selecting one of those. I can drop my email into the chat box, and I'm happy to kind of troubleshoot that with you as well after.
Great. It's just right. There's no typo in it that I can see.
Hey, I was able to send to Diane Feinstein and Padilla.
Oh, great.
Just form letter, it's very straightforward.
So glad to hear that. Yeah, I put my email into the chat box. So yeah, anyone, if there are any issues, feel free to email me and I can connect you with our support.
So maybe in a case like that, with Barbara Lee, making the call on the 22nd would be the next best step.
Yeah.
Right? If you got the form letter back, or like I did with Padilla's office, that make sure that I'll call that office on the 22nd.
I'm wondering if we should try to set up an appointment and go to her district office, like Nora suggested. Get a group of people from PD Active and go into the office.
Yeah, I think that would be great if you have, a group of people interested in that. I'm sure they would love to. And I can also help. We have access usually to individual staff contact email. So they might not be on the legislators website publicly, but we have that through our advocacy software. So we're happy to kind of help provide that information or whatever might be helpful.
So what do we do? We just contact them and find when we can come? Like, how does that work?
Yeah, you truly, sometimes I would check the legislators, so the congresswoman's website first. Sometimes they have specific meeting request forms already on their website that you can use, put that through, and then they'll kind of get in touch with you. So that they can find out information about how many people are coming, what dates would you like to go. But generally, otherwise, you can just send them an email directly and ask to set up a meeting, and they're usually amenable to it. So that's kind of what they do a lot of the day.
Brooke and I went to visit Barbara Lee's office, and we spoke with one of her staff people. I guess this was a few years ago. Remember, Brooke?
Oh, yeah.
And, yeah, I'm kind of surprised that Barbara Lee isn't on board yet sponsoring, because she seemed like in the past she was she was a member of the Parkinson'S committee, and she was, kind of more in a central role on the topic of Parkinson'S, but who knows?
I think it may be that she's signed on and it hasn't been updated on the website, because it's easy a week behind. Mark Desaulnier told me that he was co-sponsoring the bill, and it took another 2 weeks for me to see it online. And I wrote back to him that I'm glad for your support. When is it going to be updated? And then I phoned his office, and they got me in touch with the Washington people, and the Washington people must have been bird dogging it, because they made sure his name was on the next upload that they did. And I think Barbara Lee may be in that same thing, because a friend of mine who's in her districts tried to write to her using the Michael J. Fox connection, and I think it kicked him over to Feinstein and Padilla. So it may be that it's publicly not visible.
Yeah.
But that you guys know that she's signed on and the connection's been made, and it's we're downstream of that chain of information.
Yeah, and I can check with my colleague who, she's the one kind of tasked to be on top of the co-sponsor list. So she would have the most updated information that
That
might
would-
not be on the
yeah,
website. So
really
I'll check. But I think that's a great point, actually, because we have had instances where we've had a member staffer say, yep, Congresswoman will be signing on. Thank you so much. And then they kind of drag their feet a bit and we don't see that. And it just, kind of went to the other side of their desk. And so that extra push can actually be really helpful. There are some times where they've officially signed on, but congress.gov just hasn't updated it yet. But there are also times where that extra push is really helpful. So yeah, I'll look into that and I will let you all know.
If
Yeah,
you organize a group to go, you should call Berkeley side in advance and let them know.
Well, there's something in the chat about how they're not doing in-person meetings in Barbara Lee's office because of the COVID crisis, but that doesn't mean they're not doing Zoom meetings, so that's possible.
So I have a question about that. I am no longer in Barbara Lee's district. If we went as a group, should we all be part of the district with that?
I would say that's preferable. They generally look for constituents, but there are obviously exceptions to that rule. So if the majority of people are constituents, I would say that that's great. And also, you still have obvious, of course, ties to this community and to the area. You used to be a constituent. Those are all things that they pay attention to as well.
Okay. And we have one more question here. Have you worked with Cory Booker about his ideas on which members are key to approach?
Yeah, good question. I will have to ask my colleague about that, who handles the kind of more personal touches with legislators. I believe that Booker is supportive, we've been in conversation with his team. So that's a good tip for me to take back.
He spoke in Washington when Nancy and I were there.
Oh, wow.
Yeah, we have a picture with him, don't we, Nancy?
Yes, we do. And we're very proud of it.
Very proud of our picture.
That's great. Yeah, I only started in January, so I've heard a lot about the forums. It seemed like great opportunities. Yeah, and I would say, Congresswoman Lee's office, but also, whatever the closest regional office is for both senators. They're pretty well scattered around the state. So those are also great places to kind of make connections and make those contacts.
And David Cox just said success, sent letters to 3 congresspersons. Thanks.
David.
Hey, Nora, I have a quick question. I'm trying to tweet the representatives and the congresspersons, and I'm getting a fail on my Twitter handle. Have you seen that? I mean, I'm using the correct Twitter handle, but I get a pop-up by Twitter saying incorrect, please try again.
I haven't seen that one before, but that's a newer feature that we just launched. So I will go ahead and look into that and let you know. Yeah.
Started by filling out the form required and then click on the Twitter send button next to Dianne Feinstein, and I got the error message. So I mean,
so the pop-up works, but actually sending the tweet doesn't work. Is that correct?
Correct. Yeah. Let me just do the path again here. So I click on the Twitter link and it asks me which Twitter account I want to use. Then it asks for the handle and I put in the handle and it's failing. Anyway, I'll keep muddling with it on my end too.
Okay, yeah, I'll contact our support about that too.
I have found that it worked after a while. Just have to keep doing it. Same thing over and over again. It strips it. Eventually.
Would
That's
it be
great.
possible? Nora, would it be possible to get a list of representatives that are on committees that are strategic, so that if we know people in those areas, we could get them to rally around the cause here?
Yeah, I know we do have actually, I think, a list of like our top, districts or states that we're looking at committee wise. I don't have that off the top of my head, but my colleague has it. So I can absolutely, maybe I'll send it to Jen or to Nancy or Brooke, and it can be distributed to folks who are interested. Is that the best way to do that, or to the list?
Yeah.
we do that follow-up email. Okay. Yeah, absolutely. I will do that.
Can't believe how easy you make it for us. Unbelievable.
Hey, Nora, you can take Twitter off your to-do list. I figured it out.
Oh, lovely. Sorry I gave you trouble, but I'm glad it was successful eventually.
Okay, well, I think it might be time to wrap up. It's East Coast time there for Nora, so we'll let her go on and go to bed. As anybody else was able to send their letters today, just put it in the chat real quick and let us know. And it would be fantastic if you haven't already done that, to do that. We'll send out a reminder and with some instructions and links on Wednesday so that you can take action on Thursday, the day of action. And also please, if you can, forward the information to at least 5 people, friends and families. And thank you so much. Brooke or Nancy, did you have any final things to say?
Oh, I just wanted to thank Nora again for, coming to our group and speaking. So yeah, thank you. And thanks everybody else for showing up.
Yeah, we really appreciate it. And if you are inspired by this event and you want to have more like it, please just let us know. The one final thing I wanted to do also was put Nancy and Brooke's information in the chat, if that's okay with you guys.
Yeah.
People can reach out to you guys if they have any specific questions. I'll go ahead and do that real quick.
And I want to thank everyone for, that attended so quickly. I mean, we just put this up and we had really a big interest in it. And it's very exciting. For a while, it seemed like just Nancy and I were doing things. And so it's very exciting to have such a big interest, to know that so many people are interested. And I look forward to PD Active's group that is working on advocacy. This is just the first meeting, first go around, right?
Yeah, that's great. And I wanted to follow out and give a shout out to Jerry and Catherine. If you guys end up writing a letter to the editor and you want to have it signed by other people in the community, why don't you reach out to us? I don't know if that's a more or less effective way to do a letter to the editor, Nora, by one single person or having several people sign it.
I imagine several people, I'm not super familiar with letters to the editor. Maybe some of them only want that single person POV, but I think, having a group, but also having those specific details, that specific kind of personal story is great.
Yeah, I think that letters to the editor are better if they're individually sent. We're over in Burlingame, so we'll be sending them to local papers here. And the more letters they get, usually, my son used to work for Jackie Spears, so that's why, I know that it usually helps just to have the volume.
Got it. Well, would you be willing to share one of your letters after you write it?
Yeah, sure.
For the rest of us, we could sort of use it maybe as a template. I know I would be inspired to do something like that if I had something to go off of.
Yeah, okay.
And also one person could write a letter and then later other people can respond to that by writing their own, responses. So then it sort of gets its own momentum.
Yeah.
That's a great point. Yeah, and we would love to have you flag that for us if if it's in the newspaper. We do our own media tracking too, so hopefully we would pick up on it regardless. But we'd love to see that just so we can kind of show it as examples to other advocates if they might be interested in writing a letter. Just kind of let that take off too.
I have a question. I am going to. Are you affiliated at all with the PCLA, the Parkinson'S group from Los Angeles? Because I'm going to 2 meetings for them tomorrow night, and I might I would like to bring this up there.
Yeah, absolutely.
And a lot of people are interested in advocacy there, so
you could refer them to this video, which we'll be posting on the PD Active website.
We'll do that. Yes, I will do that. Okay. Just thought of that.
Yeah, they might be a member of, I'm not sure, my colleague handles are, it's called UPAC. It's our, I believe, United Parkinson's Advocacy Committee, essentially just built of different Parkinson's organizations regionally. They might be members of that, in which case they might have some intel from us already going on, but yeah, it would be great to share with them. Obviously, I'm here as a resource too. If needed.
I'll also share with people in Minnesota.
Yeah.
Great. We just got a
Great, thanks, everybody.
chat in from Wendy, who just sent a letter to Feinstein, Padilla, and Gomez. Thank you, Wendy. Awesome.
I'm also closely.
I just tweeted all three of them using all those hashtags, Nora.
All
That's
right.
amazing. Thank you.
I'll write them tomorrow.
Yeah, go Bears.
Go Bears.
Great.
All right, thanks, everybody.
All right. Good night, everybody. Thank you.
Good night.
All
Thank
right.
you.
Hi, thank you.
Thank you so much.
Thanks a lot.
Thanks, Nora. Have a good night.
Thank you for having me.